Hello everyone, hope you're having a great day today. So in this video, we're going to be going into all of the skeletal muscles. So there's a lot to get into it. So we're going to hop right into it. So first we're going to go into some tips for naming the skeletal muscles, and then we're going to identify some of the major muscles. Now, mostly today we're looking at the superficial muscles, not super deep ones or the smaller ones. All right, first up here, tips for naming. Um, this will help you when trying to remember where the muscle is. There's a lot of tips here. So, muscle location. Remember the body regions. This is the mentalis region, the mentalis muscle, frontal region, frontalis, temporalis, occipitalis. All these regions come back. Buccal or buccal, that's where the buccinator or buccinator is. So, muscle location is a big one. Muscle shape, your deltoid, your trapezius, your rhombus. So rhombus, trapezoid, named off the shape it kind of looks like. Soleus is a muscle in the calf that kind of looks like a flat fish. Muscle size. So we have major, we have minor, we have longus, we have brevis, we have maximus, medius, minimus. So all these sizes come back as well. Directions the fascicles run. So they could run rectus, they can run oblique, or they can run transversus. This is mainly for the abdominal muscles. The number of origins that they have: biceps, brachii, quadriceps. Quadriceps slightly different, it's four muscles in there. And then triceps, so number of origins right there. Locations of attachment. So sternocleidomastoid is a good one for this. It's named based on where it originates. So it originates on the sternum and the clavicle, sternocleido, and then inserts onto the mastoid process, which is the movable part. So sternocleidomastoid comes down right there. Um, and then muscle action. This is a big one for like your forearm. You have your flexors, your extensors, and your groin. You have your adductors. In your lower leg, you have flexors and extensors as well. So muscle action is another big one there. All right, let's hop right into these muscles. So the way this works, I have a little word box here. If you want to, take a screenshot of that word box and then try to fill in the model below, feel free. But I'm just going to talk through the models, and all the words are right here if you need to, scroll back or go back in the video to check it. So first up here is the epicranius, also known as the frontal belly, or let's switch to blue actually, or the frontalis. Has a couple different names, and that's for moving your forehead muscles up. And then here is the corrugator supercilii. So if we super zoom in here, you do that, you make the little lines here on your face. So corrugator, like corrugated cardboard, supercilii, a bunch of little hairs or lines. That's where that one gets its name. And then there's the two circular arrangements of these muscle fascicles here. So around the eye is the orbicularis oculi, and around the mouth is the orbicularis oris. One I didn't mention over here, temporal region, is the temporalis. And then we have some of the muscles of chewing, smiling, and so forth, or like drinking from a straw, so sucking. Over here, this one's technically pointing at one going this way, or fibers running this way. That's your buccinator or buccinator. I say that both ways because a lot of dental people say bucks or buckle, or I've heard it as buccal before as well. Over here, there's a zygomaticus major and minor. Zygomaticus, smiling, and right here is that zygomatic bone. And then right here, this is the masseter. This is the big one for chewing. And then right here in the mental region is the mentalis. So you use that for frowning. So there's a lot of other muscles right here, but we're just going through a couple. Then some of the neck, right here's that sternocleidomastoid I mentioned. Here is the sternohyoid. So right here is the hyoid bone, and right here's the sternohyoid. There's some other ones in here like the omohyoid, thyrohyoid. Like there's a few that have hyo in it. So up here when you see sternohyoid, we're seeing hyo or hyoid is going to the hyoid bone. Here are some supporting muscles around the neck. There's a anterior, a middle, and a posterior as well, and these are the scalenes. And then down here, some muscles on the chest. There's the pectoralis major, and then right here would be the pectoralis minor. And then there's some muscles for respiration, the external and internal intercostal muscles for respiration. So that's face anterior, and a few others on that model. Next up here is neck and back. So these are the ones I chose for neck and back. And then here are the models that we can look at for this. So first up is the trapezius. So trapezius is located right here on this model, and also right there on another one you might have heard is referred to as your traps. And then right here is the occipitalis. This is the occipital region, occipital bone, and so forth. And now there's two capitis muscles. There's semispinalis capitis, where the fibers run vertically, and then there's the splenius capitis, where the fibers run this direction. And then right here are the rhomboids. There's a rhomboid majors right here, and then minors right here. And then this one right there is your scapular spine, and this one elevates your scapula, so it's called levator scapulae. Here is the deltoid, and here's another label going to the deltoid. And then we have our sits muscles, or three of the sits muscles. These are our rotator cuff muscles. So there are the supraspinatus, infraspinatus, teres minor, and the subscapularis. Now we can't see the subscapularis in this image, but we can see the supraspinatus right here. I mean, not supra, infraspinatus right here. Then we can see the teres minor right here. Now the teres major is right here, but it's not considered part of the rotator cuff. Now, actually, I don't think we can see the supraspinatus on this one. So no supra, just infraspinatus right here. So no supraspinatus, sorry, I said that wrong. That would be up here above, so supra above the scapular spine, but we can't see it on this one. But we can see the infraspinatus and the teres minor. The subscapularis will come back in a future model image. And one difficult thing with the muscles and looking at these models, this is an image. This is, taking a 3D thing and making it into a 2D image. So the best way to study muscles is with models, and that's hard to do in a video here going through images. So just keep that in mind when looking at this. Easy to get turned up on your mind when looking at it. And then right here is latissimus dorsi, comes over here and inserts onto the humerus, important muscle in the back. And so that's labeling all those. And then I also included some back of the thigh right here. There's the gluteus maximus, gluteus medius, and then there's two muscles in the thigh muscles here. We have, or your hamstrings, we have the biceps femoris. Do not screw up biceps femoris with biceps brachii. And then over here is the semitendinosus, which we'll show again later. All right. Next up are the chest and abs, not as long of a list here. We have the deltoid muscle that comes back. We have the sternocleidomastoid come back, and they're also labeled right here. So some of these lines are kind of connected, so it's meant to write them in the middle. We have the pectoralis major right here. These ones form like a serrated edge, and so they're called the serratus anterior. There's also a serratus posterior. Then up next here, we have the external obliques followed by the rectus abdominis. Same thing right here. There's also an internal oblique, which runs this way, and then the transversus abdominis, which runs that way. And all those fibers run different directions and give strength to the abdominal region. And then down to the quads here, we have this strap-like muscle, which comes down through the groin. This is the sartorius right here. And then there's one of the quadriceps muscles that I labeled on this one. This is the rectus femoris. We'll also talk about the other three: vastus medialis, vastus intermedius, and also vastus lateralis. Now we'll see the medialis and lateralis in a future image. The intermedius is a little too deep. And next up, we're going down the arm. So the most difficult part with the arm are all these extensors and flexors. So understanding flexion and extension on the forearm right here is important. So remember, in anatomical position, your palms are out. So this is flexion, whereas this is extension. I know we think about this as forward and the top, but this is the posterior aspect of the forearm. So when you go back like that, you're extending this wrist angle. So this is extension, and this is you're decreasing it. So this is flexion. So keep that in mind. All the flexors will be on this side, and all the extenders will be on this side. Just one hint going through here, and kind of orient yourself. We'll get there when we go over it. But first here we have, there's that deltoid again. There's the pectoralis major coming from the chest. And then we get to the arm. The arm, we have the biceps brachii right here. Goes up towards the humerus. Again, pulls your forearm up. So flexes the forearm, and then extending the forearm will be the triceps over here. Then deep within here is the brachialis muscle. Now, coming down to the forearm, the one that connects the brachial region to the radial region is called the brachioradialis. That's running right here and also right here on this one. Remember, radius is on along the thumb, or the thumb side. So here the radius would be coming down through right there. So radialis along the radius, brachioradialis from the brachial region down along the radius right here is how you can remember that one. Now let's work our way down around. Remember, going this way. So this is the top of your hand, or the posterior aspect of your hand. So doing this is extension. So here along the radius, we have extensor carpi going to the carpal region, radialis longus, and then right here is a brevis. So there's an extensor carpi radialis longus and brevis right there. And then we have this one, which goes down to all of the digits. So this one's called extensor digitorum. Extensor digitorum. When we get down to the lower leg, there is an extensor digitorum longus and brevis as well. And then over here, we go down along the ulna. Again, we are extending. So that's extensor carpi ulnaris. Sorry. I know it's a lot. Then there's this one right here. It kind of comes across. What this muscle allows you to do is to go like this with your hand, with your forearm, and that's called pronation. So this is pronator teres when you go like that, whereas this is supination. So there's some deeper supinators right there as well. And then we get our flexors. We have the one that comes right down here, flexor carpi radialis, going down to there. And then if you look at this one right here, it comes down and then it goes through all of these tendons which go out to the palm. This one's called palmaris longus. And then over here, so if we go back to this one, this was extensor carpi ulnaris, and then right around from that, there's flexor carpi ulnaris. So right around from that. So flexor carpi ulnaris, extensor carpi ulnaris, and so forth. All right, now down to the legs. So there's an anterior view of the leg right here, and then there's a posterior view of the leg as well, and then we will be done with the muscles. Alrighty, anterior view here, these are the ones we're going to go through. Let's just go through it. All right, behind the iliac crest right here on your hip bones is a muscle called the iliacus. Can't see it unless you turn the leg a little bit. And then coming down from the lumbar region is a muscle called the psoas major. And every now and then the psoas major and iliacus are termed together when they get down here, called the iliopsoas, giving strength to this region. And then here, we have one of my favorite muscles, the TFL, or the tensor fascia lata, or latae, however you want to say it. There's arguments back and forth, but the tensor fascia latae, TFL is why we say it like that. That comes down here and then becomes what's known as the IT, or the iliotibial band, and that comes down and wraps around the leg. So if this muscle gets tight, it pulls on this IT band and can lead to some knee pain. That's a common thing in runners. Happened to me before. And now we get to the quadriceps, well, three of the quads. We have the rectus femoris, we have the vastus medialis, and vastus lateralis. So three of the quad muscles. Intermedius would be if we remove that rectus femoris there. And then here's that sartorius again, that strap-like muscle coming down. And we have some of the deeper groin muscles right here. This one's known as the pectineus. And then right here is the adductor longus. So adductor longus and pectineus. There are three adductors there in the groin. So adduction is bringing the leg down. So there's the adductor longus, brevis, and magnus. We'll see the magnus in a next image. And then we have some on the lower leg. So we have our tibialis anterior that runs right along the tibia, the shin bone right there. Then off to the side here, this one actually comes down and kind of wraps around. This is flexor digitorum longus. So flexor digitorum, flexing the digits. So pulling the digits down. So flexor digitorum longus. There's a brevis, but we can't really see it too well. And then over here, we have our extensors. So when we look up here in our list, we have extensor digitorum longus, and then fibularis brevis and fibularis longus. So here, this one is extensor digitorum longus, and this one comes down and helps extend the digits end. So pulling the digits up. So remember, your digits are your toes. We're not talking about your tarsals. So here, extensors and flexors kind of seem a little backwards. Whereas when we're talking about movements of the wrist, movements of the ankle, we're talking more about like the calf muscles in tibialis anterior. So then we have fibularis, so the fibula runs right there. There's that lateral malleolus. So we have fibularis longus would be this one out here, and then brevis is this short one right there. Kind of runs in like that, like a little feather pattern. So brevis, longus for fibularis. Sometimes you'll see any fibular area named peroneal as well, or peroneal. So there's that version. Now the posterior version of the leg, we can name a few more muscles. We have our gluteus maximus and medius right here. And here's some deeper muscles of the hip for rotating the hip. So right here's the sciatic nerve that comes out. It actually comes out right near this muscle here known as the piriformis. So sometimes a tight piriformis can push pressure down on that sciatic nerve and cause sciatica, which is some nerve pain. Not fun. Here is that IT or iliotibial band again, going from the ilium or the iliac region down to the tibia, iliotibial. Right here would be that biceps femoris, not brachii. And then here's that semitendinosus. It follows a long tendon. Let me draw this properly. That then comes down and then wraps around the knee, semitendinosus. And deep to that is, so imagine it's going underneath there, is semimembranosus. So it's just a wider muscle. So it's called semimembranosus, whereas this one here is semitendinosus. And then we have the gracilis, which is a groin muscle right there. So gracilis. And then here is adductor magnus. And then right here is another example of the sartorius coming in and then wrapping around right there. And then we finally, the last two muscles, we have the gastrocnemius, gastros, belly, nemius is leg. So this muscle means the belly of the leg. And then here is the soleus, which is deep to that gastrocnemius. Soleus, if you would remove it, kind of looks like a flat flounder, and that's where soleus, that word, comes from in Latin. And then not labeled here, but this is everyone's favorite tendon, the Achilles tendon or the calcaneal tendon. Remember, this is the calcaneus bone right here, and that comes up, and then so gastrocnemius for goes to that tendon. So that was 18 minutes going through all of the muscles. Well, not all the muscles. There are over 600 muscles in the body. So this was not 600. So there are way more deeper muscles, especially you got all your pharyngeal constrictors and so forth, like neck and face and stuff. A lot of muscles around all the vertebrae, rector spinae muscles. There are a lot we didn't mention in this video, but I just wanted to go through some of the major ones here just for this course. But if you have any questions, please reach out and let me know. But I hope you have a great rest of your day, and bye-bye.